So Dr. Joseph Thomas is an MD. His specialty is OB-GYN, and he is also an expert in health and in heart health wellness. He's actually a very progressive MD and utilizes a degree of holistic health in his actual medical practice. He's got some awesome tools. He also is a fan, so to speak, or a proponent of some vitamin and supplemental nutrition. So he is a special kind of doc. Yeah, special for sure, because many say, "Oh, that's bunk, so you don't need that stuff." But yes, he is very active and aggressive in terms of research and has done some phenomenal things in the community and in the area of research. And so I bring to you Dr. Joseph Thomas, and he's in the Chicagoland area, guys.
Well, thank you for that kind introduction. Hi, I'm Dr. Joseph Thomas. I'd like to say former obstetrician. I still do gynecology, but for the last 10 years, I've studied metabolic and nutritional medicine, and am now board certified in that area, including anti-aging and longevity. And so the research that I have reviewed for the last 10 years has been tremendously eye-opening uh, because the science is, I'm sorry, but the scientific proof is there that we can reverse a lot of the illnesses that they call chronic illness. And one of those, well, let's start off with, what are the top 3 things that cause death in the United States? Well, let's deal with the top 2. So does anyone know what those top 2 things are?
Heart trouble,
Yes.
cancer,
What was the second one?
cancer.
Exactly. So I put that, or at least I tried to put it in the chat. Heart and cancer are the areas, and what we have to consider is that the old way of looking at things, where you look at the end result and call it after the organ. So if you have a condition where you have shortness of breath and your circulation isn't good, and it leads to the heart not getting enough blood, we end up calling that a heart attack. But actually, it's a vascular disease. So if we were to call it what it is, a decrease in blood flow to not only the heart, but all the organs, it's just that the heart and the brain are so sensitive that if you deprive them, you will get symptoms faster than if you deprive your muscles or your kidneys or other organs of blood flow. So heart disease, if you just call it heart disease, and then you accept the current thought process that you can't reverse it, maybe you could have prevented it if you did the right things early in life. Same thing with cancer. If you end up saying, well, the organ that's affected is the disease instead of what led up to the disease, you're being led down the wrong path because you can't figure out why it started and what you could do to stop it, or what you could do to prevent it, or what you could do to reverse it. So heart disease, if you just call it heart disease, and then you accept the current thought process that you can't reverse it, maybe you could have prevented it if you did the right things early in life. Same thing with cancer. If you end up saying, well, the organ that's affected is the disease instead of what led up to the disease, you're being led down the wrong path because you can't figure out why it started and what you could do to stop it, or what you could do to reverse it. So I offer those two things up because heart disease is the #1 thing that kills people in the United States. Also, heart disease is the #1 thing that kills doctors and nurses in the United States. And as you might guess, heart disease is the #1 thing that kills cardiologists. That's the heart specialists in the United States. So if we were to explain and tell you the truth about heart disease, it would start as the question, well, what starts the bad blood flow? If we're to tell you the truth about cancer, it would start with, well, what causes those cells to start mutating and becoming abnormal? So the discussion would be totally different from how modern medicine starts with the end of the story and then says, oh, we can't prevent it, but you can take medication A, B, or C, or chemotherapy or radiation to treat it. But if we start at the beginning, then we have a chance to prevent it, because I like to say at all times, prevention is the best cure. So with that in mind, I want to talk about the beginning, which is, what is it that you need to know about the structure and function, or how your cells function, and how you can prevent prostate cancer, which is the subject today. But for the women, since the prostate is a gland and has the 3 different receptors, it correlates exactly to the breast, because the breast is a gland and it has the same 3 receptors. It has alpha receptor A, B, and it has testosterone or androgen receptors. So even though I would be talking about prostate cancer and how to prevent it, at the same time, I'm talking about breast cancer, how to prevent it, or really most cancers and how to prevent it. So I'm going to you can tell me if you can see the screen.
Yes, we see it.
Okay. So on one side, you see oxidative stress. On the other side, you see inflammatory stress. One is like your car, let's say, that can rust, or metal can rust. That's an oxygen causing a oxidative reaction. The other is how your body deals with stress and overreact. So we're gonna talk about that because we're gonna follow the trail to prostate cancer, breast cancer, or cancer in general, and then show you step by step how we can prevent it. So everybody has heard of oxidative stress, in the sense that we start off with everyday emotional stress that causes what we call the flight or fight reaction, where the body is programmed, just like if you needed to escape, let's say, a dog that was chasing you, there's a program in your body already set up where your heart beats faster, the blood rushes to your muscles, and you become extremely focused on getting ready to either fight or move from that area. This means the blood that normally goes to your gut for digestion, if the wild dog or tiger or something is threatening your life, you don't need to digest food at that time. You just need to exit the area. And that's why it's so important to understand that when you have stress, it overrides every other condition. And so when your hormones are out of balance, you can have weight gain, you can have degeneration of various tissues, you can have cognitive decline because the brain is not getting the proper supply. You can have, over time, blood flow issues because the blood vessels are injured, and then the blood sugar becomes imbalanced because the hormones are imbalanced. All that weighs down on the oxidative stress side. And then if you look at the other side, inflammatory response, your immune system starts to have problems. You can see the immune system having problems because some people immediately have some skin issues, autoimmune disease. And here's where the cells start to become irregular. If the cells are mutated, in other words, there's abnormal cellular response, and the body does not have enough vitamin B12 or other nutrients, then the DNA remains damaged. And what you have is the beginning of precancer cells. Now, you also can have breathing issues like with asthma or hormone imbalance. What I want to point out is that your immune system does not search for bad tissue or bad cells. So what it does is actually search for self, things that are identified as normal and self versus non-self. So your cells that become cancer initially are self, and as they become precancer and cancerous, certain proteins or other markers are on the surface of those cells that are identified as a non-self, abnormal cell. It's just like if you get a virus or bacteria infection, if the virus gets into the cells, on the surface of the cell is intelligent. It sends a signal so that the immune system knows, oh, this cell is infected. So what I like to point out is that both of these conditions have a low electric potential, meaning the amount of energy is so low that the body can't correct itself. Now, all this is happening at a microscopic level that is so small, 100 blood vessels would fit inside of one of your hairs. Those are the tiny, tiny, tiny capillaries that make up 99% of your blood flow. And it's at the end of these areas where it becomes acidic versus alkaline because you don't have enough flow of the blood, you don't have enough flow removing the toxins, you don't have enough flow. So you can imagine if you heard of a person who's diabetic that had to have an amputation, they could have been eating all the right food, but those nutrients never made it to that tissue in their foot because of what? This vascular system was damaged by the high glucose. Their nerves were damaged by the high glucose. And so the foundation of health, I like to say a lot of things are threefold, and we won't really get into the origin of that, but I'll just mention a few things. That the number one thing when it comes to your body healing itself is what I call the innate intelligence that's already in all of your cells. You might have scratched or cut your hand, you never had to tell your hand how to heal it because it knows how to heal it itself. Most people have read or heard that the body has 10,000 mutations a day from toxins in the food, the air, radiation, and your body heals it. And so your body is getting rid of precancerous cells every day. So the real wonder is, how is this body being able to get rid of 10,000 cells away? And actually your immune system could get rid of hundreds of thousands or millions of abnormal cells, because all it has to do is identify it. And can anyone guess what does a body use to kill abnormal cells or bacteria or viruses? Any guesses out there? is peroxide. Just like you can go buy peroxide, your white blood cells actually make peroxide because oxygen, peroxide is H2O2. Water is H2O. So you add one more oxygen and it's H2O2, and the negative charge on that oxygen can be used to destroy bacteria and viruses because it's like causing oxidative stress to the bacteria or viruses. So oxidative stress isn't necessarily a bad thing because your body uses that negative charge to actually kill those viruses. And I try to mention that in your body, there's a balance that's supposed to be there, but we have not really understood until recently that you have to supply. Number one was the body's intelligence. Number two is you have to supply the nutrients that it needs to heal. And a lot of people have heard the saying or the scripture that the life of the flesh is in the blood, or the life of the body is in the blood. And that's what we're talking about, is the replacement components for every single tissue, and organ are made of the stuff that's in food when food had the best level of nutritional content. So since that's been diluted, most people do not know and don't have the right content in their blood. And then the third part we already talked about, which was blood flow. You can have the right stuff in the blood, but if it doesn't flow, those cells at the end of the line are not getting oxygen, are becoming mutated, and start to become precancerous cells, whether it's the breast or the prostate or any other tissue. Then you got to have the right blood flow to get the immune systems there that will then kill it. And if you look at that process, I like to repeat that this is a picture of those goalposts, starting to rust out. That looking at the process, we're going to skip through this. Looking at the process, something as simple as walking on the grass recharges your body. It's called grounding. A lot of people have heard of grounding. What it does is recharge your body with the electromagnetic charge the earth has, which is 7.83 hertz, which is a frequency that your body needs to recharge your entire body. In the previous slide, gives the information about the covered last time, to line the entire 60,000 miles of your capillaries, and it has a negative charge. So that actually is the grounding plate within the body. So eating the right food, your whole vascular system is renewed every 6 months. If it's not renewed, you start to have decreased blood flow. And so any cells that should be killed, because as it says in Ecclesiastes 3:3, there's a time to kill, there's a time to heal, there's a time to break down, and there's a time to build up. That's the entire secret of healing right there. Because abnormal cells, yes, they need to be killed. That's called apoptosis. So the medical term, apoptosis, means the body figures out what cells are not conforming to the program or the pattern or plan that they're supposed to, and then it kills them. That's why anybody who's walking around that doesn't have cancer, even though they had 10,000 mutations every day for the last 10, 20, 30, 40 years, you don't have cancer because your immune system got rid of it before you could know it was in your body. So that's one of the most fantastic miracles that happens to you every day, because healing is a daily event. Your body heals itself every single day. And On a cellular level, the reason you need food is you got to have enough energy so that the body can do what it's programmed to do. The body's programmed, every single organ you have is renewed. You do not have an organ or tissue pretty much the same as when you were 10 years ago. Or to put it differently, your skin is not the same skin that you had as a baby. That's renewed when you were a child every 28 days. As you get older, it might be renewed 30, 40, or 50 days, but your skin is constantly being renewed. It's not the same skin. If you use the analogy, everybody knows perhaps that the skin, the snake sheds its skin all at once, and you can see the shell of the skin. It pulls out of it. But you shed your skin a little bit day to day. And I'll take a guess. What is it? What's the proof that you shed your skin every day? Where do you see your skin being shed? How many are gonna get this one?
In the tub, dead
There
skin.
you go. Ding, ding, ding. Bathtub ring. So your bathtub ring, I'm trying to write it as we talk, is actually primarily your dead skin. So, you know, you can have just had a bath or a shower, and a few minutes later, take an alcohol pad and rub it on it, and you'll see there's some dark stuff on it. Those are cells that you exfoliate. And I know women know all about exfoliation because you put stuff on your face to exfoliate the old cells so your skin could look new. Imagine that's exactly what your body is doing in every single area. It gets rid of the old cells, but you got to have the right amount of energy for that. And we covered last time the healthy glycocalyx is needed for your body to ground itself, and that there's different therapies using a newly released to this country mat that's been used in Europe that also increases the grounding. What I want to also show is that I think I have to do this differently. The body has a very narrow range. So we're going to talk about cancer, but first, like for the average person, your heartbeat normally is in the range between 60 to 100 beats. Normally your oxygen is between 95 and 100%. Normally your temperature is between 97 and 99. And your blood pH is normally 7.35 to 7.45. So this is a picture, which I think you can see, correct, of the human cell. Some say 30 million, 30 billion, 70 trillion. How many cells compose the human body? But even that's a huge number. You actually have even a larger number of bacteria, both on the skin and in your intestines. So the nucleus, where you have a nucleolus that has the DNA, how many think that that's the brain of the cell? That's where the instructions are, right? So brain of the cell? No, the membrane. So think of this. The nucleus, where the DNA is stored, is like a library. So if you need information about how a cell is supposed to be made or what protein is supposed to be produced, that is what the instructions are within the DNA. So your genes have specific genes for certain things to happen, but what comes into the cell, what's allowed out of the cell, and the interaction within the cytosol or the cell body, which is all of these organelles in here, is where the intelligence of the cells is making itself known. And this structure, which I'm attempting to show here, is the mitochondria. Now, this is the cell wall. Can everybody see that? This mitochondria has a wall. The Golgi apparatus have a wall. This is the mitochondria without it being cut open. So for things to get into here, for you to produce energy, it has to go through this membrane. Now, the reason I mention that when we're talking about cancer is that when you eat fried food, and that's omega-6, and that's damaged oil, every single one of these membranes is damaged, and so the body can't function as well as it's supposed to. That's why when you take omega-3 fish oil, these membrane structures are closely resemble how they were originally built. And because that's how they originally were built, we're able to duplicate how the body was supposed to heal itself, as long as the cell is made according to how it's supposed to be made. What does that mean? If this cell is made out of junk food, it's not gonna function properly, and the DNA can be corrupted here in the middle, and now it can become a cancer cell, or it can become a cell infected by a virus. Now the nucleus is used to produce viral particles, and it totally corrupts what the cell function is, and that's what leads to cancer. That's what leads to that's what leads to other problems. These are microtubules that are in the cell that help transport proteins and substances from one side to the other. That's how small it is. And it operates at about 70 to 100 millivolts. And this is, everybody has heard of that. The health of your cells has to do with the millivolts, the voltage of each of the cells. So if you eat food that is not providing enough voltage, then the people who have cancer have the lowest voltage because they've eaten food that did not supply what they needed for them to live. And in the background, you can see it's like your cell phone. It's the number of bars are decreasing. When it gets here, you can still be talking for a while, but next thing you know, it's not going to function, and you're going to say your phone is dead. But if you got 80% of the cells in an organ that's not working, then that organ is now not working. And just like you use up your charge, you have to charge back up. So we kind of sort of went through that. This is the slide I want to get to show you that various foods fall on different places in terms of their acidity or alkalinity, but your body is able to process whatever food you're eating, extract what it needs to build the cells, and then extract the energy to come up with the appropriate amount of millivolts for your cells to operate. So we're back here showing that if you want to lose weight, not have degenerative cells, not have memory loss, not have blood flow issues like blood clots, then you have to eat the right foods, because that layer that we're talking, the glycocalyx, the layer of your inner lining of your capillaries, that's what determines whether your blood clots or not. So if that area has worn out, then the blood vessels are far more likely to be damaged. And guess what? When you eat fried food, they have that fried food cooking for 18 hours a day. So at the end of 10 days, that's 180 hours. It might be close to 500 hours in a month. That damaged food is damaging all the membranes in each of the cells and making it so the cell can't function. And that's what leads to various illnesses, but you don't know until 80% of that cell function is gone. So It's unfortunate, but I think everyone listening, uh, I think you guys realize that, uh, unfortunately, they're putting dialysis centers all over in the Black community because Black people have the worst high blood pressure. That leads to the worst level of kidney function. And unfortunately, what I found in the last few years is that they don't tell patients their kidneys are slowly not functioning until you're on stage 4 and you almost need dialysis. They should tell people that when it's going from stage 1 to stage 2. But they figure, well, we don't know what we would tell them. Well, it's the same thing. If the kidney function is decreasing, that means the kidney is one of the, what kind of organ is the kidney? The kidney is one of the main organs, along with the liver and skin, to detox your body. So 10, 20 years or slowly, your detox system is already built in. You don't need a certain diet or teas, or you don't need anything for the initial built-in detox system to work. You were born with a liver, kidneys, and skin that detoxes your body. Now, you can enhance the detox, and the first way enhancing detox isn't necessarily a tea or a certain drink or anything. The best way to detox, to get ready to detox, is to have the right energy so your kidney, your liver, and your skin can function the way it was designed to function. It's sort of like saying you don't need special gas in your car, but if you never had a tune-up and your carburetor needs to be cleaned out, it doesn't matter what gas you put in, pretty much, you have to clean the carburetor. So cleaning the body system is an everyday event. That's the main thing I want to emphasize. Preventing that prostate cancer is an everyday event. Preventing that breast cancer is an everyday event. When you look at it like this, now we're beginning where we should begin, which is the beginning. So as I mentioned before, the #1 cause of death in the United States is heart disease. When I was a medical student, we had the thing called cadaver lab. That's the place where they have all the dead bodies. And it sounds gross, and you get used to it as a student, but half of the dead bodies are already opened and I just say dissected or taken apart to show you the damage that's already there. So the professor does the first half. So we had a baby that was unfortunately killed in a car accident. They opened the kid's carotid, and at 6 months old, the carotid had streaks of atherosclerosis or plaque already in the arteries at 6 months. That's also confirmed with Korean War. There are 18 to 20-year-olds that were killed in war, shot or blown up or whatever. They did autopsy. Hey, they had plaque already in their arteries. So you're over 6 months old, over 18, and you come to my office, I already know you have heart disease. You just don't know it, and your doctor won't be able to tell you until half of the people with heart disease have sudden cardiac death, which is called, the first sign of heart disease they have is they're dead. They don't wake up one day, or they're out doing something, they just pass out. 50%, especially women. So all those who can remember back, if we saw Fred Sanford, he would grab his heart and say, "I'm coming, Elizabeth," meaning he has chest pain or pain down his arm as a sign of, he's faking like he has a sign of heart disease. But women don't have that. I actually had a patient, all she had, she sounded like this. She called me on a Friday, said, "Dr. Diamond, my throat is still sore." That's all she had. I said, "Well, it's 5:30. Normally we turn the phones off at 5, but I didn't get to it yet." Sent her to the emergency room. She had had a heart attack, and she was thin. The average woman at 5'4" should weigh, let's say, 135. In the African American community, Black Americans, 80% are overweight. That means they're going to have more plaque. That means they're going to have more decreased blood flow. And in her case, she was at extra high risk and had a triple bypass. she smoked a pack of cigarettes a day for the last 10 years. So that put her at high risk. What does that cigarette smoking do? Damage that glycocalyx, which means you're going to have more blood clots. You're going to have more what they call atherosclerosis or fatty streaks in the arteries. So hers had got so bad, it blocked off the blood flow. And that's why she had a heart attack, and that's why she had to have surgery. But the exact same thing, you decrease the blood flow to all of your tissues, and we're going to say the breast and the prostate, such that the immune system is no longer able to identify and get rid of precancer cells, and those cells grow unchecked. And let's flip over to breast cancer. A mammogram can only detect breast cancer when it's the size of the, let's say, eraser on a pencil, 1 centimeter. By the time it's 1 centimeter or the size of an eraser on a pencil, that's 1 billion cells. You have 1 billion cancer cells the first time they can detect it on the mammogram. And likewise, the doctor does the rectal exam on a male patient and thinks he feels a lump or the PSA goes up or some sign or symptom. There's 1 billion cells. So even though they'll say, well, that's early detection, and I understand what they mean by that, they don't have anything to detect any earlier. But I also know that it's a lifestyle change, is eating more plant-based foods, is keeping your system balanced, and in some cases, the CBD can help balance not just your immune system, but other signals, other systems in your body rely on signaling between the systems to stay in balance. And so that's why there's so many conditions that are helped with natural products, because it rebalances the body. So these conditions can be verified by all of the studies that's already been done that show that it's the vascular system that is compromised before any of these other things come up. And that I would say if you wanted to start on a diet, I would put it to you like this. In some cases, the number one thing that you need to do to improve might actually be stopping some things that are causing a problem as opposed to starting something new. And that's a little bit disruptive, because what I'm talking about is what is the main purpose of each of your cells. So your cells have a built-in program, so they're programmed to heal themselves. But if you don't have the right energy, you can't do it. If you don't have the right nutrients, you can't do it. So the idea of having each cell having a purpose, your cells are motivated or inspired to constantly heal themselves. We have to stop doing the thing. So I'm gonna ask the question, what if you wanted to make sure you died 10 years early, name 1 or 2 things you could do, or type in a message. What could you do? I can't spell. I'm typing. If you smoke 1 cigarette a day, it damages your immune system and your vascular system such that over 10, 20, 30 years, it would cut 10 years off your life. And so the reason it leads to cancer is, as we had in the other slide, it's the oxidative stress. It's the damaged immune system that's not removing the cancer cells before they become cancer, meaning the precancer cells. So you're inhibiting a system, a detox system that's already built into your body. And all of these systems combined, I call it scarless healing. your body is able to fix what's broken before you even know that it's broken. I like to ask this question. Let's go back. Why do people get cancer? That could be the same as you see before you. The question, why do trees fall in a storm? In other words, your cells are tested with stress every day, but all of those cells don't become cancerous. They're resilient, and the ones who do start to be abnormal, your body gets rid of it. I mentioned you have apoptosis. The other system, I'm gonna call it, is it's called autophagy. They say autophagy, A-U-T-O, autophagy, F-A-G, Y, which is to eat. So your body will take the components or cells that's not working and recycle them. It doesn't just throw it away or kill it or get rid of it. So you have a system to stop the abnormal cells, and you have a system to recycle. And both of those systems, Nobel Prizes were awarded in 2000, I think it's 7 and 14, for the doctors who discovered these systems. Like I said, over time, more and more has been discovered, especially, that's why I like to read all of the research, because from the time I finished medical school in 79, there's been thousands and thousands of papers, textbooks that explain how the body works and operates, which it did not know before. For an example, before 1980, no one had tried to operate on a fetus and then put the fetus back in mom. What they did was see on an ultrasound, the baby had an abnormality, a defect. They actually opened mom up, put her to sleep, opened her up, took the fetus out of the womb, fixed what was wrong, put the fetus back in the womb. And then when mom was delivered 2 months later by C-section, you couldn't even tell that the baby had an operation because it healed without a scar. That's the power that's within each of your cells to heal and return to normal. I try to, in my classes I give, explain part of the teaching I received when I went to Harvard at their mind-body clinical medicine course, because they taught with meditation, the way that that healed was a deeper part of yourself within the subconscious, the conscious, and the spirit being. You're able to have a complete rejuvenation of your body. So because of that, we're not able to experience disease if the body heals itself. So just like this sample, if the tree is not able to heal this dead area, it gets weaker and weaker, and then when a storm comes, it blows over. Well, you can imagine this weakness here is like an organ where 80% of the cells aren't functioning, and so it's so weak. This would be the cancer. This is the part of the body where this is still strong. So all the flow that you need is there. And the last slide I wanted to, I'm sorry, I'm skipping over it. There it is. I call it, and most people don't know about it, but there's, in a hospital, everybody knows code blue, where, you know, someone is close to not breathing or dying, and they have a team to come resuscitate the person. Code red is if there's a fire in the hospital, they call code red. Everybody's directed to a station. You got a team. The code red team goes to that area and makes sure the fire is put out and makes it safe for everybody. The highest state of emergency is code pink in the hospital. And that's because it's a state of emergency because somebody they think is abducting, hijacking, or kidnapping like a baby or a child out of the hospital. And so they call that code pink. Well, I call it the real code pink is that your stem cells, which is what you need for your body to grow properly, is what you need to not have cancer. Those are being abducted by eating food that has toxins in it, by being exposed to too much electronic frequencies, or being exposed to even toxins in the air. Those things are attempted to be removed by your body. But if the stem cells, because of aluminum, mercury, or herbicides, they are abducted and turned off, and now your body can't heal itself. Your scarlet healing system is no longer functioning 100%, and that's how you end up with cancer. So I'm gonna open it up to questions. Actually, I've gone over the time I wanted to. And Betty, if there are any questions, we can go over that.
Okay, let me see here. Well, actually, there are no questions. Okay, so I'm sorry, there is one question that Naima actually put in here earlier. And that is, are there other treatments for blood clots in the legs in addition to blood thinners?
Yeah. So let's talk about that just briefly. I kind of touched on it. The number one thing is you want to maintain healthy blood flow to not end up with a blood clot.
Mm-hmm.
For an example, if you want a blood clot, all you have to do is like smoke cigarettes, that causes damage in that glycocalyx layer, and then just sit around all the time so you don't have good blood flow. Now the capillaries that are injured have platelets that stick to them. The cholesterol stuff sticks to them. And then the next thing you know, there's a blood clot, because the blood clot is trying to help repair the damage that has happened. So your body, you can bruise yourself by falling. That's a blood clot, but your body's in balance. So it heals that area and then takes the clot away. When it's out of balance, the clot just grows bigger and bigger. It blocks blood flow. Now, if that clot breaks off, it can go to the lungs and cause pulmonary embolus, or it can go to the heart and cause lack of blood flow. So you could die from these kind of blood clots. And so the blood thinner is trying to keep it from clotting more, number one, while your body gets rid of it. So your body has an internal way to get rid of blood clots. When they give you blood thinners, that's them trying to stop it from getting worse. And so there's some supplements that we can talk about at a later time or offline that will make it so your body is much less likely to develop blood clots, and it will help them go away. There's also some enzymes and some natural products that basically do the same thing. And the doctors would rather give you drugs and say, well, don't eat a lot of kale or greens and stuff because we can't really measure your clotting time. Yes, they can, but you would have to take charge and eat the exact same amount every week, which would equal the blood thinning stuff they give you. But if you ate a lot on one day and not enough on the other day, they would not be able to regulate, your PT, PTT, or INR, or the blood factors, the biomarkers that they use. But working with someone who could have understanding that this is the same amount of different vegetables that have the nutrients in them that act as blood thinners. For an example, they would tell you, oh, don't take too much omega-3 before surgery because omega-3, which is what I recommend, thins your blood. Well, that's the same thing a blood thinner does, but it's actually a nutrient that your body needs to repair your cells. So those are some of the ideas to start with. And, like I said, we're able to help using natural things that actually work better than some of the drugs.
Exactly. Even CBD has blood thinning property, and that's why they request that you stop taking CBD prior to surgery also.
Right, exactly. Because they would say, well, we can't regulate it because we don't know how much you're gonna
Exactly.
get, and we need it to be stable. So
Right.
that's why you have to work with a health practitioner that can help you balance a natural product.
Exactly. So I'd just like to thank Dr. Thomas for that phenomenal presentation. I learned so much, and I'm sure each of you did too. And just before we go, I'd like to just kind of recap. He talked about the energy within the cell. And this is exactly why we at Akana have moved to include bioscans in our arsenal as a way to increase our knowledge about what is going on in the body on a cellular level, so that where we find those items out of range, we can do something about it. Remember, he talked about how early on disease is detectable in the body, and that it actually starts when the energy within the cell is at its low points. So these are some of the things that are detected via the bioscan, because it identifies what's going on, again, on the cellular and the microcellular level. He talked about cleansing and the body's natural ability to cleanse itself even on a daily basis. Unfortunately, many of us have never cleansed and have been eating diets that were less than optimal, and thereby have a lot of mucus, inflammation, toxins, as well as parasites in our digestive system and in our body, and therefore causing us to not be able to digest and assimilate our foods very well, and thereby causing somewhat of a malnourishment within our bodies. This is excellent time to really take charge of our health and to perform or take advantage of the cleansing process that we offer here at Akana, either a 7-day cleanse or the 21-day cleanse. 7-day, because sometimes people say, oh, I can do 21 days. But it's an excellent place to start at 7 days and then progress to 21 if an individual thinks they can't do that. The other thing he talked about was why we have some of these problems in the first place. And basically, it's because we're not eating right. He talked about the fried foods and how it damages the cells, the membranes of the cells. And so that also relates to eating the wrong foods, the lectins and other components that cause us a certain level of dysfunction in the body. So this is one of the benefits of eating right for your blood type, knowing your blood type in the first place, and then being able to eat according to your blood type. So I just want to share my screen really briefly. And Oh, fiddlesticks. Just want to go over. Here we go. So here we go. The shift is here. When you know better, you can do better. So again, we have our step 1 of our cleanse, the flat belly lifestyle cleanse, which eliminates the parasites and the excess mucus. And then step 2, our liquid colonic, as we like to playfully call it. It cleanses the colon, and it actually cleanses the entire digestive tract. I'd like to call it cleansing from the rooter to the tutor, because actually it cleanses the stomach, the lining, the small intestines, as well as the colon. And it detoxifies the bodily organs, because once your digestive system is cleansed of the mucus, the parasites, and the crud that's lining the intestines, the toxins that exist there are eliminated, and your digestive system then signals the organs, the other organs in your body, to release their toxins, because now they have some place to go. And then step 3 is our superfoods blend, as well as our new product, our protein shake. And together they provide us with a pretty much of a balanced meal replacement, not only nourishing the body with these superfoods and this plant-based proteins, but also providing the body with the raw material that Dr. Thomas talked about, the raw material to for the cells to be able to now, I'm sorry, for the body now to be able to rebuild the cells with healthy raw materials. And so it's going to build healthy cells. I know you've heard the term garbage in, garbage out. If all you're putting in your body is that fried foods that are not appropriate for your blood type, foods that are less than optimal and are deficient in minerals and vitamins, then your body doesn't really have the raw materials to make healthy cells. So these superfoods and this clean, balanced protein provide your body with that raw material. And then the latest addition to our arsenal is the aronia berry juice, which accelerates weight loss. Yep, the taste is very good. I love it. I could drink it several times a day without any problem. Reminds me of cherry juice mixed with maybe a little prune juice. It's kind of got a little tart but yet sweet taste to it. Excuse me. So we've added that to our cleanse, taking 1.5 ounces twice a day. And these new additions actually eliminate the need to do the juicing that we used to do, the 3 juices a day. Now, this aronia berry juice is a phenomenal superfood. In fact, it's been coined the king of superfoods. The average um, the average antioxidant berry has an ORAC value of, I think it's somewhere in the neighborhood of 20,000. Our aronia berry actually through a proprietary processing nets us in the neighborhood of 41,000 plus on the ORIC scale. So the antioxidant properties are truly, truly phenomenal. Also, it's highly anti-inflammatory, so that adds to the protective, the beneficial properties of and activities of the cleanse in and of itself. I'm going to stop sharing my screen. The other thing about the aronia berry is that numerous research studies have been done on this berry. Some of the most notable were done actually by the National Institutes of Health, where they found that the berry was actually neuroprotective, cardioprotective, anti-cancerous, anti-tumoral, and had a very significant impact on not only the body's ability to maintain a healthy glucose level or blood sugar level, but also it excuse me, it had a very positive effect on the body's ability to act as an anti-infective. They did some studies on seniors in nursing homes and found that the juice actually helped to prevent urinary tract infections. The other issue that I found exceptionally great in terms of prevention and or hopefully treatment at some point was that they found that the aronia berry, like I mentioned, was neuroprotective and that it helped to eliminate and or prevent the amyloid plaque buildup in the brain that has been found to cause Alzheimer's disease. And I thought that was tremendously important because as we age, many of us are, I don't know how to get out of here. Many of us are experiencing, oops. Are we back? We're not. Hold on. Uh-oh, I'm lost now. Here we go, Zoom. There we go. Whew. Many of us are experiencing issues with memory, excuse me, cognitive decline and that kind of thing. So I just wanted to share those tidbits with you guys. And again, thank you so much, Dr. Thomas, for your stellar presentation. I'm sure each of us learned a lot and recognized that that food for thought gives us plenty of ammunition and reason to really pay attention to our own bodies, new research being shared about health and wellness, and recognizing too how important it is for us to continue to share this type of information with all that will listen so that we can become better stewards of our own bodies. And at some point, all become the CEO of our own body. So thank you very much, Dr. Thomas, again. And with that, we will say good night. And thanks for coming all, and see you next week. Same time, same station. Good night, all.
Good night. Thank you.
Good night.